Spinal compression fractures can be one of the most painful things someone can experience. And unfortunately, they're very common as you get older. They are usually related to osteoporosis and can happen even with minor trauma or even without any trauma. They can also take a very long time to recover. And when you're older and you stop doing things that you like to do for a period of time, sometimes you may not be able to do them again. Luckily, there is a medical procedure that we do very frequently that can make you recover faster. And today I will explain everything you need to know about kyphoplasty. So let's get started. First, let's talk about why a kyphoplasty might be needed. This procedure was developed to treat painful compression fractures of the spine. So what is a compression fracture? Well, the vertebrae are these building blocks that support our spine and essentially support our entire body. But each vertebra is like a little box. They have the outside, which is called the cortex, which are the walls of the box. And inside the vertebra, you have bone marrow, which is very soft. So a compression fracture is when you essentially break these walls of the vertebra, like squishing a little box. And when you keep putting weight on it, this compression can get worse and worse to the point that sometimes it can completely collapse. And these fractures most often happen due to osteoporosis, but they can also happen in patients with cancer or anybody that has a severe trauma. Younger people can have compression fractures when they have a severe trauma. Let's say on a car accident or when they fall for a very high height on their feet. But younger patients usually can heal these bones very quickly in a matter of 1 or 2 weeks. So when you have cancer or osteoporosis, it could take months to heal and people may continue to have pain for a long, long time. Although the pain is the most important thing, this can also lead to loss of height. People can lose several inches and also can lead that hunched posture that elderly people may have. We're talking about kyphoplasty, which can help stabilize these fractures, reducing the pain, and sometimes we can even restore some of the vertebral body height. So what is a kyphoplasty? It is a minimally invasive procedure where we insert a small tube into the fractured vertebra. Through this tube, then we can carefully insert a balloon and inflate the balloon inside that little box, which is the vertebra, so we can restore the bone's shape, height. And after inflating the balloon, we can then fill that space with a material called bone cement. We call bone cement, but it actually has the properties of something like an epoxy. A lot of my patients are engineers and they want to know what is the cement made of. And it's a material called PMMA, or polymethyl methacrylate. It's essentially a plastic resin. We mix that material on the table and we make it into a paste. And when we insert this in the vertebra, it solidifies very fast. And in a few minutes is rock solid. It's also a very nice material because it kind of integrates with the bone and the bone can grow into the material. And once this is said and done, this will be the strongest bone in your body. And because this is instant, it can provide immediate pain relief and prevent the fracture from worsening. Now, you should not expect to be pain-free right away. That will still take a few weeks, but the pain is usually better, especially if we're doing it in the right circumstances. So who is a good candidate for kyphoplasty? So the kyphoplasty works best if it's done within a few weeks to a few months after the fracture. So it works well for patients who have acute fractures or what's called subacute fractures, which is within a few months after. You see, when the fracture is already healed, then the kyphoplasty will not have any effect. And that can be a problem because sometimes patients may wait 6 months because they're afraid of doing a procedure. And if they continue to have pain, by that time, the procedure is probably not going to be effective. Now, not everybody needs a kyphoplasty. Some patients may rapidly improve after the fracture, and those patients may heal on their own. But if you're not improving after a week or two, you probably should consider, especially if you're getting worse after a week or two. That usually means that the fracture is progressing. Now, let's go over what happens during the procedure. The kyphoplasty procedure is usually done under local anesthesia with mild sedation. Most of the time it doesn't require general anesthesia, although in some cases it may be necessary. We then use X-rays to carefully guide this narrow tube into the vertebral body. We then use a drill to create a little space so we can insert the balloon. The balloon is then inflated carefully under fluoroscopy. We then remove the balloon and inject the cement inside the vertebra. We have a lot of experience with these procedures, and the procedure usually takes about 10 to 15 minutes per vertebra, and most patients will go home the same day. Obviously, patients that do not have any support at home will tend to keep them overnight at least. While we do a lot of this, and kyphoplasty is generally a very safe procedure, like any other procedure, there are potential risks. This can include bleeding, infection, or reactions to the anesthesia or the sedation. There is also a small chance that the cement might leak into the surrounding areas, causing nerve compression and worsening pain. Although, considering we have superb imaging and the technology is so good, this is really, really rare. What will you expect after the procedure? Like I said, most patients will experience significant pain relief right away. However, they are not going to be pain-free, and they're still going to have pain for a few weeks. Usually, I recommend at least a week of rest before starting physical therapy, since the physical therapy can be very painful during this initial period. You should also avoid heavy lifting or extraneous exercise for a few weeks after the procedure, but we do recommend walking with moderation so you don't lose those important muscles. After a week or two, you should start stretching and light exercises and physical therapy. In most cases, we will send a referral for physical therapy. We will then follow up with you in about 2 weeks to see how you're doing and answer questions. One controversial topic is whether you should wear a brace or not. I feel like after the procedure, a brace is not always necessary, but if you feel like it's helping with your pain, I think it's okay to use for a few weeks. Now, obviously, wearing a brace for a long period of time is not that great because you will rely on the brace, and that will actually weaken your muscles long term, which is not a good thing in elderly patients. Also, some patients find the brace really uncomfortable. Finally, after the kyphoplasty, we know that that bone will never break again. However, if you had a compression fracture, odds are you have severe osteoporosis, and you are at high risk for having other fractures in the future. Not only vertebral fractures, but you're also at risk for having femoral fractures or wrist fractures that can be very devastating as well. So I would say the most important thing that you can do for yourself is to do something to prevent new fractures. And this can include strengthening exercises, a healthy diet rich in calcium and vitamin D, but essentially the most important thing is actually to take some medication to increase your bone mass and prevent new fractures. Luckily, nowadays, there are many new medications that are very effective in increasing the bone density and preventing new fractures. Although many patients that have compression fractures have taken Fosamax and Prolia in the past, there are new medications that are believed to be a lot more effective in preventing new fractures. And these include Forteo, Tymlos, Evenity, and so forth. It is very important to discuss this with your primary care or your endocrinologist so you can get in the right track. In summary, kyphoplasty is a very safe and effective treatment for painful spinal fractures. It is extremely important to help you regain your mobility and improve your quality of life, as well as preventing muscle loss from disuse. It is important to get back to the activities that you like to do as soon as you can. As always, if you have additional questions, feel free to reach out to our office and we'll make an appointment to discuss your concerns.